Hello everyone, welcome to my presentation tonight for final presentation night. I'm studying cardiovascular medicine and medical missions this year under the mentorship of Dr. Samuel Woolbert. And so a little bit about why I want to do medical missions. I was walking through Nashville about 2 summers ago, and we were walking down a street called Broadway, which is the music street of Nashville, and there were people, homeless people all throughout the street who had like dirty teeth, had dirty clothes, like basic hygiene, basic health was not covered. And so that kind of got me thinking. I knew I wanted to study cardiology last year going into my first year of ISM, and so that kind of got me started on like kind of the philanthropical side of medicine. And so it's kind of the ability to help those people and the need those people displayed kind of really made me wonder, like, well, what can what can doctors do to provide for these people? And so it's kind of a little bit of how I got into medical missions. And so a little bit more about me. I'm a drum major and a tuba player for the Frisco High School Band. I'm highly involved in my youth group at First Baptist Frisco. This is my second year in ISM, as I said earlier, and I am planning on attending Oklahoma Baptist University in the fall to major in biochemistry. And so a little bit about the ISM program. It stands for Independent Study and Mentorship, and it is a class that allows students to interact with professionals in their area of expertise. So that's Baylor Heart Hospital. I get to go there every other Tuesday to spend time with Dr. Woolbert, my mentor. And then what I've learned in ISM, a few things. I've learned professionalism, how to dress nice, how to have a working resume, things like that, organization skills, time organization, and like papers and things like that, medical etiquette, bedside manner. I've learned a lot of that from Dr. Woolbert. And also some brief medical knowledge, certainly not enough to practice medicine, but has given me a good introduction to the field. And I've learned, most importantly, that I do want to pursue a medical career. And so what ISM has done for me, kind of going into junior year, I wasn't really sure what I wanted to do, but through this experience I have gained some confidence knowing I want to pursue medicine. And so some quotes that I hope to use to define my ISM experience: whatever you do your work heartily as for the Lord rather than men. And so kind of how that quote plays into, I guess, my mission this year is like medicine can be used as work for the Lord rather than for men. And so I believe that through medical missions and things like that, you can really I can apply my passion for medicine to a passion for the Lord. And then another quote, which I found kind of a little bit funny: medicine is the only profession that labors incessantly to destroy the reason for its own existence. And so if you kind of think about it, there's like this kind of running joke that like there's job security in a lot of jobs. But medicine, the goal is you're trying to make it so everyone's healthy all the time. And if that happens, then doctors are out of jobs. And so it's kind of an interesting little idea, I guess. And so it's kind of cool how, I guess, medicine is working to its own end. And so my topic this year, cardiovascular medicine. And so I'm interested in science and interested in work done in the medical field, helping people. I'm also, heart disease is the leading cause of death in the United States, and I have some significant family history of heart disease. And then my ISM experience last year in cardiology has kind of continued into this year. I know I want to do cardiac medicine at some point. And then focus on treatment in rural and underdeveloped areas. And so the risk factors of heart disease can be treated easily with medication and physical activity. Even in areas like developing countries, there is still necessity for cardiovascular treatment. And so this, like medical treatment in general, is a good source for ministry. If you can help people be healthy, then you can spread the gospel and things like that. And then also there are a lot of like medical ethics concerns in how we currently treat medical missions. And so hopefully kind of if I get into the field, we can work through some of those ethical issues. And so some of my research this year, I spent a lot of time researching like what medical missions is, what that looks like as to a doctor. And so Christian medical missions is the provision of free or significantly discounted medical treatment to people in America, around the world. And the goal is to show God's love and to share the gospel. And so there's multiple ways you can do that. People can go and build clinics in these areas. Like up there's a clinic in Haiti. You can go on temporary medical excursions, which is where doctors will go for like 1 or 2 weeks to one of these areas and actually treat as many patients as they can, try and get them healthy. Kind of like a short-term solution if they don't have very many doctors in these areas. There's also physician training, where people will go to areas where there are already a lot of doctors and they will train the doctors who are already there to be better doctors. And so a lot of that is like specialty training. So like American cardiologist, American neurologist, even American family practice doctors will go and train those in their respective specialties. And then also full-time medical professional, where a organization or just an individual will go to an area and will kind of set up shop there and actually be a full-time missions professional there. There's also missions residency programs where you can work with like Samaritan's Purse, there's a few others, and actually during your formal medical training you are working in the mission field. And so that's another route you can go with that. So some mission organizations I've researched: North Texas Missions, which is based here in Dallas, and so I've interviewed a lot of people there, and they do medical missions trips to Honduras. They also do other just normal mission trips throughout the rest of the year. And then World Medical Mission is a part of Samaritan's Purse, and they are the medical missions side of Samaritan's Purse. And so they go all around the world, a bunch of different countries. They have one of those missions residency programs, and so that's another option, a bit bigger of an option. And then there's also other independent groups. Churches will send individual medical missionaries. They'll send individual on little trips, and so it's another way you can go. And so, like I talked about earlier, medical ethics, there's some concerns with that in the area of medical missions. And so medical ethics asks the questions like, what's a good thing to do and what's the best thing to do? And so it might be good to go and provide treatment to people in Honduras, but it might be better to go and train doctors so those doctors keep their jobs. If you go and provide a bunch of treatment, then I guess you could have that doctor in that area out of work for 6 weeks, 7 weeks, and then that's not necessarily good for their economy. And then what resources do different areas most need? So in the Philippines, they already have a bunch of doctors. In Southeast Asia, they already have a bunch of doctors. So we don't really need to send doctors over there. We just need to make those doctors better. Whereas in Haiti, recently after the earthquake, they don't have the medical clinics, so it might be good to go build clinics there, things like that. So kind of medical ethics is trying to figure out what's the best thing to do. And then there's also some medical ethics concerns with foreign residency programs. Are they really providing adequate treatment for doctors and things like that? So before I consider doing one of those programs, I would need to really research that and figure that out. And then the ultimate question is, less quality care still better than no medical care at all? And so it's kind of a difficult question to answer because if people are going to be sick, they might be a little bit less sick, but we wouldn't treat them as well as we do here. Is that really ethical? Is that really right? And so nobody really knows the exact answer to that. So some interviews I've been on this year. My first interview was with Bob Johnson. He's the founder of North Texas Missions. He actually works at Oracle in Frisco. And he kind of does this on the side. And so I went and talked to him, and he kind of gave me an overview of missions and what North Texas Missions does in general. And so he says they're more than just medicine in the traditional sense. They also do optometry and dental medicine. And so they'll go to Honduras for a 1 week medical missions trips, and they'll see about anywhere from 2,000 to 3,000 patients over that week. And they'll provide them medications. Everyone gets to see a doctor. Everyone gets to see an optometrist. Everyone gets to see a dentist. They even get a free pair of glasses. And so it kind of provides some treatment, kind of intermittent, because in Honduras, the problem is the nearest hospital is sometimes 2 to 3 hours away, and the bus fare to get there would cost more than these people make in a month sometimes. And so it's good to have this, this team come down and provide some medical care. Kind of some relief for some stomach aches, things like that. We also had a brief discussion on ethics, just kind of touched on some of the things I just talked about. Foreign relations, they had to bring in a autorefractor, which is an optometry tool. It's like a really expensive optometry tool, donated. It's $60,000. And so the issue is they weren't sure if they were going to have to pay the 10% import on that, because it's a very expensive piece of equipment. And so but Honduras was very open to that. They appreciate people coming into their country to help with their health, and so they were able to get that in as a work leave type resource. And so Also, North Texas Missions has an interesting focus on deaf education and special education training. Because these people do not have amazing prenatal care, children are actually born with more propensity towards some deafness, special education needs. And so what they do in these areas, they teach the people living there in orphanages and things like that how to treat for these kids and how to care for these kids. And so that was also a really interesting thing, and that's where Mr. Johnson believes North Texas is going to continue to grow, is in that area. And so Dr. Bazell, he's a missions doctor for North Texas Missions. He kind of showed me the medical side of missions. We talked about some of the common cases, and actually some patients would come in with so much earwax in their ears that they couldn't hear. They were practically deaf, and that's just because in this area they didn't know that you needed to clean out your ears. And so it's kind of an interesting thing that kind of shows you a little bit of the extent of the need in this area. And then he also talked about how people will have they will actually go deaf because they don't take they don't have access to Tylenol, which we do, so fevers last for weeks instead of days, and so that does permanent damage to nerve tissue leading to the brain, so that causes deafness, sometimes even blindness and things like that. And so we also talked about some of the medical resources in this area. There's not really, in Honduras at least, there were not huge hospitals. There's one in the central city, but so these clinics are a good resource for the people in rural areas who don't have access to that. And then Dr. Coley Marsh, he is a optometrist. He also works with North Texas Missions. And so he kind of talked to me about optometry and the culture of missions. And so I asked him what he liked most about going on these trips, and he said the patients there, they'll wait in line for 6 hours. They'll get there early in the morning, right when the sun comes up, and they'll wait there for 6-7 hours to get in to see the doctor and to get in to see Dr. Marsh. And so he said that he really appreciated that patience and then the thankfulness when they were there to help. He said he really liked his ability to help because there is so much need. There's something that these people can do, the doctors can do for everyone. And he also, of course, liked the ability to spread the gospel and kind of share God's word through his missions work. And so it's awesome to hear. And then I also interviewed Nurse Erin Baker, and she's also works with North Texas Missions. And she talked to me about her personal missions experience. She said it was very eye-opening. She wasn't really sure, she didn't know the extent of medical need until she actually went on the trip and saw it. And so kids were walking around barefoot, things like that. It just kind of almost amazing. She was in awe at what she was seeing, and just because it was so much poverty and so much things like that. She said it was a very rewarding experience. She was able to refine her skills as a nurse, and she was also able to share the gospel and things like that. And she really encouraged me that when I get the chance to go on a missions trip, to actually see what it's like. And so that's something I'm hoping to do in the next couple of summers. And so Dr. Alexander, he was my last interview, and so what he did, he's a retired OBGYN, and he actually works with Medical Education International, which is a division of Christian medical and dental organization. And so what he does, he goes to Mongolia, and he trains physicians, and so he trains specifically OBGYNs in that area so they can become better doctors. And so his organization takes 2-week trips a year. Different specialties go, so like I said earlier, cardiologist, neurologist, OBGYNs, internists, all these doctors go over there and they actually train these physicians. And so what they're hoping to do is they're hoping to, get those doctors to provide better care. Like I was saying earlier, it wouldn't be the best to actually send physicians over there because those physicians would be taking some of the Mongolian physicians out of work. And so it's better if we send over doctors to train up those physicians. It actually increases the value of their services and increases the health of the population at the same time. And so it's a kind of a win-win situation. So that was a really good interview. I'm going to talk about some of the work I'm doing with Dr. Alexander later on as well. So my mentorship, I would like to take this time to thank Dr. Wilbert for his awesome help this year and last year. And so a little bit about Dr. Wilbert. He's an interventional cardiologist at Legacy Heart Center and Baylor Heart Hospital in Plano. He went to Centenary College for his undergraduate and LSU Medical School for his doctoral degree, and he spent his time in the Baylor system for his residency and fellowship. And he's on Dallas Magazine's list of best doctors. I'm going to brag about him a little bit because he's so awesome. And so some of the experiences I've had with Dr. Wilbert, this is my second year under his mentorship. And so he does diagnostic catheterizations. I've got to see a few of those where he'll actually go and do a catheterization. I'll get to see kind of from start to end that procedure. I'll get to look at the screen as he's like pumping the dye into the heart so I can see the blood flow and things like that. I get to look at some of those results and kind of see like where blockages are in the heart and kind of get a better understanding of that. I also got to see his response to a code blue, which was a heart attack in a patient. And so I was there for about 3 hours watching them bring this man who practically died on the table back to life. And so that was an amazing experience. And then patient visits at the hospital and in the office, so I kind of get to see like post-surgical treatment, long-term prevention treatment and things like that. And he's also led me through some guided research in sport cardiology last year over like the causes of young athletes' heart attacks and things like that. I've also learned a lot about heart structure and function, different diagnostic tests like stress tests, EKGs, and things like that. And I've learned like what medications and treatments would be prescribed based on different results to the test. And so those are some of the experiences. And this slide was actually really hard to make, like what I've learned from Dr. Wilbert, because I have learned so much. And so just a little bit, professionalism in the medical field. I've learned how to interact with patients, how to interact with nurses, how to interact with other doctors. I've also learned about excellence in practice and attention to detail. And so I'll see Dr. Wilbert go over the files of patients, take files home so he can study up on his patients and figure out like what the best way to treat these people are. And so that's really important for me to see as like just how much work goes into caring for these people and how much dedication Dr. Wilbert shows to that. And then patient care, both medical and bedside manner. It's kind of awesome to see how he'll interact with patients, and he'll he'll make some jokes. He knows like when they go on vacation, things like that. And so he kind of builds relationships with his patients. So for a few reasons, because he cares about them, but also because if he kind of shows that, then they're probably going to be more likely to kind of listen to what treatments he provides, and so they'll be healthier. And so arteries of the heart, so just kind of some technical details, like the actual structure of the heart, I've learned that. The purpose for different cardiac tests, I've learned that. And then also overall just that the main focus of medicine is to help people. And so Dr. Wilbert like kind of brings that mentality to everyday work. He's always there to help people, kind of going the extra mile to make sure they get the best care, the best service, and all those things. And so those are awesome things to learn going into the medical field. So a little bit about cardiology. I did do some research assessments on cardiology this year. So one was on breakthroughs in cardiology, and so I learned about the first catheter to the heart, and it was actually a student who thought he was like trying to find a better way to get medicine into the heart. And so what he did, he took a urinary catheter and he ran it through his through an artery here in his like chest, and he ran it into his heart. Then he walked down a flight of stairs to the radiology department, took an x-ray of himself with the catheter still in him. Then he walked back up the stairs, took the catheter out, and sewed himself up. And so he was a student. He almost lost his job, but he did do the first catheter to the heart, and so that's kind of a cool story. Also medications, they keep getting better, keep getting more affordable, extending the lifespan of Americans and people in developed countries. They say over the past 20 years, 4 years of like the 7-year increase in our life expectancy are due to breakthroughs in cardiology alone. And so that's kind of some amazing work being done in the field of cardiology. Also, I learned about a poly pill, which would be a combination of cholesterol medication, blood pressure medication, and some statins, which could be given to large populations because it's not too high of a dose, and it might be a good resource for people in developing countries, like a cost-effective solution. And so that's something to kind of consider, like doing medical missions wise. And so if you look over there, that's a picture of a diagnostic heart catheterization. And so what they would actually do on the left is a right heart catheterization. So they'll either run it through the femoral artery in your leg or through your arm into the right side of the heart. And so then they'll use an x-ray machine to take pictures of the heart after they pump through a dye into the heart. And so you get to see how blood moves throughout the heart, throughout the veins surrounding the heart. And then on the right is the left catheterization, pretty much the same type of strategy. And so that's kind of what I got to see those procedures with Dr. Wilbur. That's a picture of them. And so my original work this year, I decided to do an assessment of medical need. And so the problem I came in contact with was that mission organizations have the tendency to establish like a specific blueprint, and they just apply that to a bunch of different countries. But the problem with that is that the medical needs in those different countries are as diverse as the people in those countries themselves. And so to best serve these different areas, it's important to discover like what are the specific needs of these areas. And so I decided to choose 8 countries: India, Swaziland, USA, Malaysia, Laos, Russia, Niger, and Mexico, and kind of do an assessment of what medical systems they have in place and like what would be the best way to assist them. And so my solution was an assessment of medical need. And so general country statistics like GDP per capita, total population, life expectancy, physician density, just kind of some things that might indicate how much money they have to spend on healthcare, how long they're living, how much treatment they're receiving, and then also overview of medical systems, like what hospitals they have, what clinics they have, things like that, and then major medical concerns. So like in Africa, Ebola was a major concern for a while, and still is, and malaria, things like that, like what might be a specific concern for a specific area that we might not even consider living here in America. And then also recommendations. I'm going to provide a recommendation for medical assistance. And so some objectives of this is to provide resources to people planning mission trips. This isn't necessarily me planning a mission trip. This is like if someone hopes to plan a trip in the future, they can kind of use some of this research and better like plan those things. And then also gain experience researching medical systems, especially if I plan on maybe creating a missions organization or things like that. That research skills will be important. And then also gain an understanding of like what like medical need are in these different countries, like to what extent they need help. And so those are kind of some of the objectives. Here's an example of one of my one of my pages for the United States. And so we're in North America, we have a population, all those things, and so we currently have a private healthcare system that's kind of transitioning into kind of a quasi-public healthcare system. Physician training, they have 8 years of formal education, and so the greatest need here in America would be homeless medicine, and so that's kind of where we would go with that. Honduras, whereas the GDP per capita of the United States, 52,000 to 4,000 in Honduras. So they obviously don't have as many resources to spend on healthcare. The government spends a lot more money on healthcare there, but still not enough to cover all their need. There's a lot more, disease and things like that. And so for Honduras, it would be better to do a little bit of physician training, but also to send physicians because they do have a limited number of physicians. And so that's just kind of an example of what I was doing with my original work. And so what I hope to accomplish with that, and so I gave it to Mr. Johnson and then our missions pastor at church. And so if anybody comes to them looking to start these mission trips, they can access that research. And so for my final product, I'm doing a video medical training in Mongolia. And so kind of some of the ideas I had for my final product, kind of a case study off of my original work, maybe going in and actually planning like what specific area in a country you could go to, like planning a trip for that. So I was thinking I could do that, or I could help Mr. Johnson with his trip to Honduras, kind of help him work on some of that. Or then Mr. Quijada gave me the idea I could do a video conferencing type training solution with Dr. Alexander, who I interviewed, or then also help an existing missionary in the field, either send resources, research, things like that. And so those were kind of some of the ideas I had. And so the goals I had, I decided I would like to do the physician training out of those. And so the goal of this is the organization is Medical Education International, and so what they do, they take two-week trips to Mongolia a year to train physicians, and so their primary goal is to spread the gospel, and then kind of a secondary goal is to provide education, and that is as an avenue to show love and to share the gospel again. And so kind of those are their goals, and so kind of like what would providing this like this system add to that? And it would allow for more focused education and increased communication during trips to Mongolia. So if you can kind of train them throughout the year, when you go there you can provide even more specialized training, and you can have even more communication because you've been communicating with them throughout the year. And so that was kind of the goal of this whole system. And so the challenges we ran into challenges pretty quick. The language barrier at first, Mongolian compared to English doesn't translate too well, and so there are physicians in Mongolia and there are physicians here who speak both languages, but that certainly was a difficult thing to kind of try and figure out how we're going to work with that. There's also a 12-hour time difference, so it's not like we could if we set up an 8 o'clock morning seminar over here, that'd be 8 o'clock at night in Mongolia, and not many of the physicians would be able to go to that, and not many of the volunteers here would want to wake up at like 4 in the morning, so we're training at 4 over there. And so kind of that 12-hour time difference was another concern. Privacy concern, make sure patient information is secure. You don't want to be, I guess, sending patient information over the internet, and so that's kind of another concern. Internet capacities. In Mongolia, we were unsure like what actual availability it would require, and video conferencing requires a very large internet connection, like very consistent as well. And so also limited resources. This is a nonprofit organization, so there isn't a ton of money to just be spending on this missions thing. And so the solution that we came up with would be a pre-produced training video that could be emailed to physicians and watched on their own time. And so the reason that we felt like this would be the best solution is it accommodates a slower internet connection, because you can download it over a length of time instead of having to watch it immediately. It also allows for physicians to fit the training into their schedule. So if it's like a 30-minute training, they can watch the training over a lunch break, or they can watch it at home when they have some free time and things like that. So it allows for, I guess, better availability to watch that. And if produced correctly, it can solve translation issues. So if we have the video in English, we can have a translator pre-record the audio and play it over the video, so that there is, I guess, not the issue of translation. And then also there would be a follow-up question and answer forum to answer any questions and to develop personal connections. And so the physicians would still be able to receive kind of that personal connection with the physicians here in America and the physicians there in Mongolia. Still be able to share the gospel kind of through that type of interaction, and they'd be able to answer any questions that they might have pertaining to the training, so they would gain a full understanding and full value from that training. And so implementation of this plan, we planned the solution that took about 2 weeks to kind of figure out exactly how we're going to go about doing this, solve all those problems. Then establish connection with Mongolian hospital, which I'm actually really excited. We just finished that part, and then producing the training and distributing the training. And so we know that Mongolia is ready to accept this, and they're ready to kind of work with this program and kind of develop it. And then also the follow-up question and answer session, kind of make sure they have gained full understanding. And so that's kind of where we're looking at moving forward with this. And so the impact that I hope this will have, it will improve treatment in Mongolia. This organization works with the largest hospital in Mongolia, so if you improve the doctors there, then you'll, in essence, improve the doctors around the entire country. It will allow to spread the gospel, which is also important. It gives them an awesome opportunity to continue to build those relationships and things like that. Also, it allows me to gain some experience in communications, something I haven't really tried before, so it's kind of good to get some new experiences. And it's an actual representation of my research in medical missions. It's actually a resource for these missionaries, and it's like I guess an awesome thing for them to be able to do. And so kind of to wrap up my presentation, I just hope that kind of moving forward with this product and moving forward in my study of missions, that whatever I do my work heartily for the Lord rather than men, and that hopefully someday there won't be a need for any more doctors. So thank you.